pain's not permanent. It's a signal that something in your body isn't optimal, but it doesn't mean that you're broken and will never work well again.
Patients will come in with these diagnoses that have been either told to them by their providers or they've looked on Google MD. They hang on to these diagnoses and think that they're broken. So we like to use words that are definitely not broken type words.
We're different than most chiropractic offices because we focus on you as a whole person and not just your spine. We tie in rehabilitative exercise and global movement as well, because that's what tells us why you have pain, not just looking at a single bone or two in your spine. So even if you have pain in your low back or your hip, that can be related to something totally different in the body, and if you never look at it, you might never find that underlying cause for someone's pain.
We want to make sure that we know what's going on, what's your triggers for pain, what are your goals? Do you want to get out of pain so that you can go on a family vacation, or do you want to get out of pain because you're having troubles lifting your grandkids? Or are you simply here to improve your performance in baseball, softball?
We also want to make sure that people are educated on why their pain is coming about in the first place, because we found when people can have that initial awareness, that's super empowering as well. So if you can identify your pain triggers, then you now have control that you didn't have before. We also want to empower our patients through movement. We want to make sure that people have the tools to keep themselves feeling good long term.
We try to give exercises that will directly affect their pain. We're working to make you better than when you actually came in. And what I mean by that is 100% would get you back to where you were before the injury and would more than likely come back. If we get you to 110%, we've trained you or taught you how to move correctly.
After we've helped people relieve their pain, we want to address the reasons why those muscle, joint, movement imbalances happened in the first place. And then by giving patients those tools, actually changing how they use their bodies, that's when they have the long-term relief that they're seeking.
We don't want those long-term care treatments. We want long-term solutions. Our goal is to basically never see you again. If we don't see you again, that means we've done our job.
By incorporating this model with patient care, we've seen amazing outcomes that when we change how bodies move, how they function, we can have dramatic improvements in how they feel.